Hello, my name is Mark Vickers. This is Addressing Mental Health and Chronic Pain in the Workforce. So welcome. I am the Chief Research Analyst and Data Wrangler at the HR Research Institute, which is powered by HR.com. And I have an excellent guest today. Steve is the president and co-founder of JOGO Health, a Mayo Clinic portfolio company headquartered in New Jersey. JOGO provides comprehensive virtual care for migraine, chronic pain, pelvic health, and neurological disorders. We're going to talk about all that today. Sivas has over 25 years of healthcare experience, having worked for a consultant for large pharmaceutical companies. And Siva actually has 3 US patents related to AI and healthcare. So welcome, Siva. What else would you like us to know?
Oh, thank you. Thank you, Mark. Yeah, I came from the pharma world where we marketed drugs mostly for many of the indications that you're seeing on the screen, migraine, chronic pain, and pelvic health. Then I now moved over to non-invasive treatments and non-drug treatments. That's what we offer. So it's a good transition from going from drugs to non-drugs. Not that we don't need drugs, we definitely need medications, but we also need to look at other non-invasive technologies which can address these things. So that's my passion now, looking at non-invasive treatments and comprehensive care of looking at all the things that a patient suffering from these diseases need, including exercise, diet, how to control the amount of medications we take, and also looking at other interventions. That's my passion. And we have AI now, so we can do a lot of interesting things. But yeah, I mean, I'm passionate about this topic of uh, treating chronic pain and other neurological disorders through non-invasive treatments. Yeah.
Yeah, no, it's a great topic. Obviously, just in terms of pharmaceuticals, pain-related pharmaceuticals, there's been a lot of difficulties in recent years. So it's great what you're doing. First, before we jump into this, we want to run a poll. This is going to be partly about stress, and we're asking this question about whether stress is prevalent in your organization. We have done some research on this in our own mental health research. So this is actually duplicating some data that we'll see after you respond to this. I'll kind of show you what some of the data we collected recently looks like. So, Siva, it's going to be interesting to talk about the relationship between pain and stress and some of these other issues, because that really doesn't come up very often in these discussions.
Right, that's right. So I think during COVID, when we really started taking a deeper look at mental health at workplace due to the crisis that we had, now I think it shows that 53% say that stress, but also there is a comorbid condition that goes along with stress, which is chronic pain. Yeah, Mark, you can take a look at the poll. It's interesting.
Yeah, no,
Uh,
it is. So we're seeing that 30% say strongly agree, 53% say agree, and then we have neither agree nor disagree at only 10%, disagree 4%, strongly disagree 3%. So the agrees really have it by a very large margin. And that makes sense given the fact when we asked this question, we saw something quite similar. Uh, in this data that we got from over 200 HR professionals responding to a recent survey, we found that a whopping 78% of HR professionals responding to that survey said stress is prevalent in their organizations. 62% say they personally feel stressed out at work, and who's responding to this are HR professionals, tend to be members of HR.com. Only a minority of them feel as if their organizations are good at helping employees address stress issues. So this is a very prevalent problem, and it's something that we're not really good at dealing with. So Siva, could you explain the relationship between pain, stress, and mental health in today's workforce?
Sure, Mark. Again, the around 2021, Lancet, the one of the major medical publications during COVID, published a series of editorials, actually scathing editorials about how pain is treated right now in the wrong way. So they basically said pain is a neurosignaling problem. You cannot suspend it by putting painkillers. So right now we just go and just by default we get a painkiller either over the counter or something that we can be prescribed. But what happens when you have pain, very specifically chronic pain? The chronic pain creates anxiety in the body, or anxiety creates chronic pain. It's one or the other. Then all of them that results in muscle tension in the body. So people who have very high level of anxiety and chronic pain have a very high muscle tension. That's a vicious cycle. So you have muscle tension and you have chronic pain, and that leads to anxiety. And because you have a lot of chronic pain, you limit yourself from physical activity, which even adds to that. So basically, it's a vicious cycle, one feeding into the other. You have anxiety, which may create chronic pain, or you may have chronic pain, which creates anxiety, which then creates muscle tension in your body, which limits your physical activity, and it just creates a vicious cycle. By just simply sending painkillers into the body, you're not addressing the root cause, right? You have to break the cycle, which is basically pain, anxiety, muscle tension. What we do is tackle one of the easiest one, which is the muscle tension. So we basically relaxing the muscles in your body. You could simply address the one of the problems, and you can break the cycle, right? That's basically what is needed. So I would advise everybody just read the Lancet article about how to treat chronic pain and anxiety, but there is a real correlation between them, direct correlation, right, between pain and anxiety, mental health and chronic pain in general. Anybody who is suffering from mental health, they will have chronic pain.
Wow. Yeah, I mean, this is such an important issue, and I don't think people think about it all the time, except people who have been in pain. My father really suffered from chronic pain in his later years, and he dealt with some of those issues. So I've seen that in real life. Breaking that cycle, I think, is really important. So this is some other data that you have. I thought this was interesting. See about what exactly is co-occurrence. We should probably talk about that. And then what is this co-occurrence data telling us?
Right. So this is again a published study. We looked at chronic pain, anxiety, and depression, and are they co-occurring, right? And how much does it really impact your day-to-day life? So people who said that both chronic pain and anxiety and depression are co-occurring to them, 69% of them said it's actually hurting them at workplace. So work limited due to health problems because they're having chronic pain and anxiety and depression, they're not able to function at work, right? That's really the takeaway from this slide. That's about 69% of those who said, I'm having chronic pain. I'm also having anxiety and depression, and I'm not able to work, right? It's limited to some extent when you want to take a daily errands. It doesn't really, I mean, still 40%. And social activities, it's up to about 55% at work because your anxiety level goes up during work, and then really it feeds into that cycle that I just talked about, chronic pain and anxiety and depression, then muscle tension, and you're not able to function. Most of our work are now limited to staying in front of staring at a computer. So it kind of aggravates this whole thing. So basically what this is saying is 69% of those who are suffering from chronic pain and anxiety are telling it's actually hurting them at work. It's impacting their productivity, basically, what this is all about. Yeah.
Right. So that red bar on the far right is your 69%, right? And that is a very, very high number.
Yeah.
And it does make sense. I just think it's something that we don't always think about. This is the next poll question. We're asking, in your experience, do employees who frequently suffer from painful conditions such as migraines or musculoskeletal issues tend to suffer from more mental health concerns such as stress or depression? We're simply asking yes, no, don't know. One of the reasons we're asking this question is this is another piece of data that we collected from a large number of HR professionals over the last several weeks. So I'm interested to find out what you all think about this and kind of compare it to what we've already collected out there. Again, this is migraines. We're going to talk a little bit about migraines, both in terms of our research that we've done, and Siva has has great research on this topic, and we're going to talk about that from a medical point of view. So it should be very interesting. All right. So the idea here, we're finding that the yeses win. 60% said yes, only 3% said no, and 37% said don't know, which is interesting. When we look at this data that we collected, this is from 680 HR professionals. We found something similar. We found that the yeses were 51%, the don't knows were 44%, and the no's were just a really slim margin, just as we saw with our poll. So what's interesting here, Siva, is that a lot of people just don't know. They honestly, they're not familiar with this topic, and so hopefully today we can give some people some information. So I find that interesting.
It's not surprising. You're going to see in one of the data slides that I have now next, Mark. It's even doctors don't, right? That's the scariest part, that patients who are suffering from migraine are also suffering from other issues. Doctors are not asking that question. That's the scariest part, right?
Yeah.
And a little bit of numbers. In the United States, 40 million people suffer from migraines. 40 million, right? 40 million people suffer from migraine. There are only 100 migraine specialists in the country. Only 100 migraine
100.
specialists. 100. There are only 100 doctors who are specialized in migraine. Think about where these patients are going otherwise, right? They are going to their primary care to get their prescription. So they're not getting the full comprehensive care that is needed for migraine, which kind of talks about why we're having this issue that many people don't even know. So a little bit, another interesting thing that is happening is the climate change is making migraines and other neuro conditions worse. So this was a study that was done last 2 years ago. You are seeing more and more children having migraines. Think about your child suffering from migraines or tension headache, right? The other one. Then you are working mother or working parent is basically taking a day off because his child is, I know personally, one of my friends, his son had a tension headache for 45 days continuously, and he had to take time off to take care of them. So this is one of the things that's driving it. Recently, Harvard Business Review published this paper by Dr. Olivia Didam. She's an advisor to JOGO, just on full disclosure. She wrote this paper saying migraines are a serious problem and employers can help. Employers currently not even taking a closer look at that. I'm sure not. I'm not saying everybody. Many of them not even taking a look at what's happening to your employees who are suffering from migraines. And UK, the lady that you're seeing in the picture with the blue coat, she was a lawmaker, very rising lawmaker who was predicted to be the next next important person in UK politics. She quit her job, saying that I'm suffering from migraines, I cannot work. This happened last year, and she went and now advocating for employers to provide support for patients or employees who are suffering from migraines. So migraines and also tension headache, we should not forget that. That's also an important one. Migraines and tension. It's a real problem that's hidden inside your organization that you are probably not even aware. And you see this from the data because people don't talk about it. Because what happens is when someone says I have migraine, they assume that their supervisor thinks they're not productive, right? So it's a topic that they try to hide from their supervisors. You talk to your own loved ones, they will say that I don't want to talk about this. I don't want to bring it up because I will be perceived that I'm not productive. So it is happening just like mental health was hidden in our organization. Migraine is hidden inside your organization, and employees are not talking about it. Um, there was even a survey done a few years ago. It is 78% of people suffering from migraine think they don't want to talk to their managers about it because they will be perceived not productive. So that's 78%. So yeah, so that's what migraine is doing. We'll talk about the impact of mental health and migraine in the next couple of slides. Yeah.
Yeah. So could you tell us why is there a relationship between global warming and migraines? Why do you think that's happening?
We don't know, Mark. We don't know the reasons. I'm sure some scientists know somewhere.
Hmm.
But people say migraine is something that because of even the temperature changes, people get a migraine attack, right? So you
Hmm.
move from a colder place to a warmer place, you get a migraine. And because the weather is changing in a dramatic fashion, and we have never seen 100 degrees in New Jersey, now we are seeing continuously, right? Your body isn't ready to take this, right? It'll take some time for you to adjust. That's probably what is triggering. That's my theory. I don't know what really is causing, but the numbers are showing that it's going up.
Yeah. Can it ever be related to environmental circumstances like burning fires and that kind of stuff, which I know a lot of people are going through
It
recently?
could be smoke definitely. Um, Smoke definitely is something that triggers migraine in many patients. And migraine is, there are various different factors that affects men and women in different circumstances. Why migraine attacks? Smoke could be another one. Of course, the heat waves could be another one, or it could even be simply the clock, your body clock is not adjusted to these extreme changes in weather, right? Could be the other one too, right?
Right. Some good chats going on right now. Jillian said accessibility and affordability for medication is another struggle in regard to pain medication, I assume. And boy, that is definitely true. A lot of changes have been made in recent years, and I think that's sort of made it harder for some people to get the medications that
Yeah,
maybe they should have.
yeah.
Uh, it, and another Sanjay says that migraines and tension headaches are not reported for fear of being labeled as unproductive. And that is definitely true. We've seen some of that in our research, which I'll show you in a little bit. But many HR people are well aware of that, and they feel like the managers, the immediate supervisors of people don't really understand these issues very well. So let's go to this next one. Siva, we've also done some research in this area. We found that it's widely misunderstood condition that is migraines. What can you tell us about migraines and how do chronic pain and migraines impact mental health in the workplace?
Right. So this research is not ours. This came from Association of Migraine Disorders. It's a third party that did this research. And they claim that migraine is the second leading cause of disability worldwide, period, right? Second cause of disability. And it is the leading cause of disability for women under 50 years old. It's the number one disability for working women, right? And think about it. We have programs in workplace for musculoskeletal health. We have programs in workplace for mental health. We have program workplace for all kinds of things, pet insurance, everything. But we don't have a program in many companies for migraine. But it is the number one cause of disability for women under 50, right? And it also directly impacts your claims cost if you're a benefits person joining, right? Uh, six to $12,000 in medication costs. The newer meds were costly. The older meds were over the counter. That was not costly. The newer meds are very costly. They're injections. Then 35,000 in presentism cost. That was calculated per employee per year. $8 billion in ER visits. This is nationally now in the United States. I know some of you are from joining from other countries, but I'm talking about US numbers here. $8 billion in ER cost and sixth leading reason for ER visits. In some geographies, it is the number one reason for ER visits, especially at migraines and
Wow.
tension headache in children. Um, and it's higher than musculoskeletal mental health in ER when it comes to ER visits, right? So that's again very interesting and scary numbers that we have to address this at workplace. Yeah.
Right. And it must be alarming for people when they really get intense pain. They may think it's something else aside from migraines or tension headaches too. So it's very alarming. Do you know anything about ocular migraines, Siva? Does that come into the play here at all?
Yeah, migraine. I mean, there are different types of migraine, Mark,
Hmm.
chronic migraine, episodic migraine, and migraine triggered by this and that. Yeah, we see that a lot. And again, different medications don't work for different conditions. And my comment going back, there are only 100 migraine specialists in the country for 40 million migraineurs. Where do they go? Normally, they walk into a urgent care or their primary care, and they are given the drug that was recently promoted by the medical rep because they don't have time. I'm not blaming the doctors. Doctors don't have the time to read the new research on these things, so they are given whatever drug, whatever, and they're you look at migraine patients that currently we treat from Mayo. Um, it's been going on for like 20 years and they have probably tried everything in the world, right? Because when you're in pain, you would try anything, right? Even on a toothache, right? You would just do whatever people want you to do. Even you write a mortgage for someone else. That's what someone told me. If I'm in a toothache,
Mm,
I'll give my entire wealth to someone else, right? That's how we are in pain. So
yeah.
yes, we see different kinds of migraines. Definitely, episodic migraines and chronic migraines are the most common ones, right?
Mhm.
But yeah,
Yeah.
there are types as well, which is
Yeah.
visual.
Yeah. The reason I ask about ocular, someone in my family gets those. And the first time she had one, she had no idea what it was. And she ended up going to see the doctor and they said, come in right away because I didn't know what it was either. But it really, for those who don't know, it just sort of
Migraine
limits
with
your,
aura. Migraine with
yeah,
aura.
yeah,
Right.
big aura. So it kind of limits your vision,
Yeah.
which can be quite dangerous and obviously hard to work when that happens,
Yeah.
if not impossible. So this comes from our state of migraine disease. We did this study in 2021, and we found that 70% of HR professionals say that many of the supervisors in their organization lack knowledge about migraine disease. So that's that large bar on the right. There's a lot of other interesting data. A lot of folks suspect that their supervisors don't take these things seriously enough because they don't really understand it. So if you haven't had a migraine, you may not really understand what's involved here. So that's some of the data we're seeing here. Siva, do you think HR should consider offering help to employees suffering from chronic pain and migraine?
Absolutely. I think it should be ranked above musculoskeletal in my personal opinion, because of what it really does. But currently, all the current offerings that are support that is given is based on claims data, Mark, right? So they look at what's driving your claims. Yeah, your musculoskeletal is driving your claim because people are having surgery. So you put a musculoskeletal program in place, but mental health was like this. Nobody had any claims on mental health until you just came out and just, you know, really hit us, right, during COVID. Then we started offering mental health benefits to employees. So migraine is something like that. You're not going to see a lot of claims. Lately, you might be seeing because the drug prices are going up, but it's a hidden ticking time bomb inside your company that that is impacting productivity, right? And I definitely think we can see from the data, it's not like we're making that up. It's all from all surveys is popping up. Employers definitely should give uh, uh, take into consideration providing support for employees with migraine. Absolutely, just like anything else that they are currently offering,
Mm,
because it's impact. There's a direct correlation with mental health and productivity.
right. Well, Wendy had a question, Siva, which is definitely over my head, but she asked, do you think migraines are at an uptick also due to the 5G cell phones?
I don't know. I have to. I don't know. Maybe I always think any exposure to radiation, which phones actually emit electricity to some extent, higher use of it would definitely trigger anything. Could be high frequency. I'm sure there is some data that supports it. I really don't know the answer, uh, but you could see that if you are in if you we used to have the cell phones, we used to hold it near to our ear before Bluetooth came. I can see our whole face is heating up, right? And it could
Mhm.
be. We don't know, so we don't know whether 5G is triggering this or not. But I'm sure overuse of any electric signals will have impact in your body. Yeah, from
Yeah,
radiation perspective. Yeah.
and probably also musculoskeletal things, right? Like if you're using a phone in a certain way all day, you may have some chronic pain from that if you're some via some kind of ergonomic issues as well. I would think. Not a
Yeah,
doctor at all, but I'm just thinking about some of the
right,
people
right.
I know.
Of course, your posture impacts not only musculoskeletal but also migraines, right?
Right.
So your posture also contributes to it.
Yeah,
Yeah.
definitely. Okay. So what do you see as the connection between the mindsets of people with migraines and the healthcare practitioners who are treating them?
So this was the comment I made about physicians not knowing the connection between migraine and mental health, right? So this was a survey done by the American Migraine Foundation with the help of Biohaven, a pharmaceutical company. They said two-thirds of persons with migraine feel it is important to discuss mental health with the healthcare professionals treating their migraine. So almost 67% of these patients think they should discuss that with their healthcare providers, but only one third of the healthcare providers even sense that the person with migraine want them to focus only on the headache. Sorry, only one third of the doctors think that um, they're here only for the headaches. They're not here to discuss the mental health. So basically, they're not even trying to have a conversation about mental health with the patient who just came in with migraine, which is
Mm,
scary because doctors don't even know the direction, or maybe because they're going to a non-migraine specialist who's busy, they want to see the next patient. There's no time to discuss any of these things. They're just there for the migraine medication and they're out of it, right?
right.
So this is the problem. So you could see that the actual sufferer wants to discuss, but the physician doesn't want to even have a conversation. Physician doesn't even know that. And now we are having a problem because most of the times mental health, unless the doctor initiates it, it's very hard for a patient to open up, right? So it's on the doctors to really help the patient feel comfortable to discuss about these things. But if they are not even aware of it, uh, then what do you do, right? There was a comment that came as a neuro. If not every neuro is also not a migraine specialist. That's another issue, right? Because they're general neurologists, very difficult for them to focus on these things. So that is the staff physician shortage is also contributing to this. Right?
Yeah, it is interesting. Do you think part of it is they don't want to bring up mental health issues because they are afraid that the patients might take offense on that type of issue, or what's the cultural dynamic here?
So there are screening now, which they have to do. Actually, when Medicare pays for it, for doctors to pay anybody with suffering from chronic pain, they ask some very subtle questions about mental health. But doctors are trained to ask the right questions to see if it's impacting, so they know how to start a conversation. But they're
Mhm.
not, because they don't even know that this is impacting the mental health. The migraine is migraine. I'm here to treat just the headache. I'm done. And they're not even starting that conversation. So there's a lot of education that needs to be done even on the physician side about this relationship, right? About migraines and mental health. Yeah.
Right. Some good chats going on. Oliver says, what about TMJ, which I guess is what,
Yeah, I mean, when I say
transcendental.
chronic pain, it's just the pain that you get in your facial muscles. Yeah, absolutely. That's another huge thing, which we also address that. So when I say chronic pain, we are talking about not only migraine, we are talking about TMJ pain, we're talking about tension headache, we're talking about fibromyalgia, we're talking about chronic fatigue syndrome. All of them fall under this category. We are focusing on this particular side is migraine, but we are talking about the whole chronic pain, which are which I'm not talking about musculoskeletal, which is we already have programs in place to address it, but this is chronic pain, which are not musculoskeletal, right?
Mm,
So that's the major piece of the problem with mental health.
mm. Okay. So doctors should know better. They kind of do know better, but they don't really follow
Yeah.
what they should.
Partially due to the staff shortage we have, Mark, they don't have time, right?
Mhm.
Physicians, they don't have the time to do this full. There are various reasons, right? Most of the clinics are owned by private equity firms now. They want doctors to see 10, 15 patients, 5 patients, right? So there's a lot of pressure on doctors too to get the patients out of the office as soon as possible. So there's a lot more dynamics happening in the medical field that's
Right,
contributing to all these things, right?
right. Okay, so moving from migraines for a minute, incontinence is a kind of a taboo topic, and no one really talks about this topic, but what's the impact of incontinence on mental health issues?
Right. So we wanted to put this slide in here to also talk about the impact of this. This is coming from the National Association for Continence, which says that 90% of patients are suffering from incontinence. I'm talking about urinary incontinence, fecal incontinence, bowel and urinary, feeling either isolated, alone, depressed, or hopeless, right? I can tell this from my own family. This happens. When you are incontinent, you are isolated, depressed, or hopeless because you don't want to embarrass yourself in a public setting. You're avoiding longer trips. You don't want to sit in a meeting for 2 hours in an office meeting and walk 10 times to the bathroom. It's all contributes to. And the next slide is the most scariest one, which we need to take a look at. That 62% of women age 20 plus experience urinary incontinence, right? And 15% of men age 20 plus experience urinary incontinence. After 50, it becomes 67%. And especially after, someone had a prostate surgery, uh, then, men suffer from incontinence a lot more than women. But in the early ages, it's a pretty high prevalent, as you said, it's a taboo topic. Luckily, now people are opening up about it. And what do they currently do? They go get a diaper and they just try to live with it, and it still doesn't cure the problem they have, right? So it
Mhm.
contributes to mental health, absolutely. Yeah.
Yeah. So what are actually the causes of this? I could see that you get that as part of the slide.
Yeah, I mean, mainly for women, it's postpartum. Postpartum, we don't take care of pelvic health, so it requires they develop incontinence. Obesity is the other one, diabetes. Then um, and generally, I study a lot of evolution psychology and other things. They say pelvic part of a body hasn't fully even evolved, they say, right? So we still are evolving as species, because that's the part of the muscles that are not really fully functioning to some extent. So it requires a lot of training and making sure they're strengthened and everything. So, but the major causes are lifestyle, then obesity, and of course postpartum, which contributes to women incontinence. Then men, um, primarily when they age, the prostate surgeries, prostate develop, that contributes to incontinence, and then basic weakening of the muscle because we are sitting for God knows how many hours a day, right?
Mhm.
And that contributes. We are not mobile, right?
Right. So Rick didn't actually have a question. He was saying that we thought we were going to talk about how employers could help people with chronic pain. And we're about to jump into that, Rick. So thank you for your patience on that one. Um, so with that in mind, tell us a little bit about this slide, Steve. I find it interesting. When I think about pain control, I generally think about medications, but what role can these digital technologies serve?
Right. So we offer a digital health solution to manage chronic pain, migraine, and incontinence pelvic health. So it's a non-invasive technology, Mark, and it uses a sensor. It doesn't send any electricity into the body. Don't confuse this with TENS unit that you might have seen at a physical therapy clinic or anything like that. It basically helps you control your muscles. So basically, what happens? Let's take migraine. We put these sensors on the muscles on the forehead, the frontalis muscle on the forehead, and on the facial muscles and the trapezius muscles. And there are mind body relaxation techniques that are given. These are clinically studied, FDA approved, 8-week program where we help these patients reduce the muscle tension. Remember, we talked about how muscle tension, anxiety, and pain are interconnected, right?
Mhm.
We need to break something that is breakable, right? We don't know how to break pain because pain is a neural signaling, but muscle tension is something we have control over. So muscle tension, We bring it down through a program of 6 to 8 weeks of basic. It's a protocol that was developed by Harvard Medical School, and these employees take this kit home or they get shipped home, and they work with a physical therapist or a clinician. It's a 45 minutes a week program. They follow through with this clinician, and after 6 to 8 weeks, they see a significant reduction in their muscle tension in their body, which breaks this pain anxiety muscle tension cycle, which can cure, treat migraine significantly as good as the drugs. We are not telling patients to veer off their drugs immediately. They still can take the medication, and they should be on medications if the doctor's prescribed. And the other thing we provide is access to specialists. So if you don't have a headache specialist, in your area, there are virtual headache specialists we connect them with, so that they can look at your entire uh, course of what else going on in your body to do the right thing. So that's first thing we do. Then we also manage your medications to see what else are you taking. Are you taking unnecessary medications? Are you are taking stuff that's not even proven clinically, right? Sometimes somebody's told you saw on YouTube and you started taking it. Then we look at your diet and see. So it's a very comprehensive virtual digital health program. So we give this device to help you with the muscle tension reduction and anxiety reduction, which is pretty significantly will reduce your migraine attacks. Then we help with medications and exercises too. This program also reduces stress and it helps you sleep better, right? And studied clinically. That's on the migraine and chronic pain side. So let's say someone suffers from TMJ pain, right? Not migraine, right? We talked about TMJ pain. The sensors go on those muscles that are different. So in TMJ pain, it's normally the temporalis, the facial muscles, right? You put them onto the facial muscles, and the protocol is slightly different to bring the tension down, and then you basically reduce the muscle tension in those. And it has actually, for TMJ pain, this is the number one recommended treatment by Mayo Clinic and others. And Mayo currently uses this significantly, and they have a lot of patients on this. That's on the pain side, right? This also treats chronic lower back pain, where we put the sensors on different muscle groups and reducing the muscle tension in those, and that results in pain reduction. Actually shown in a study that is superior to opioids in treating chronic lower back pain, and for FDA for that gave a breakthrough for this device. So that's on the pain side. When it comes to pelvic pain, pelvic floor for incontinence, you do the opposite because your muscles are weak, right? That's where you're leaking, and you do the opposite of what you just did with pain. You put these sensors on outside, not inside. You just put it on the pelvic area, and you are given strengthening exercises, right? It's an 8-week program. Non-invasively, you work with a physical therapist, and then they're normally pelvic floor physical therapists who are also trained in pelvic floor rehabilitation, and they give you these exercises through this device, and it has shown to reduce, you don't have to win meds, and it has shown to reduce surgeries, and it works. The nice thing about it, the program also includes relaxation techniques and mind-body techniques. So your anxiety and depression also addressed, right? And sleep is improved. So it's a comprehensive program, well studied, and with support of Harvard Medical School and Mayo Clinic.
Excellent. Yeah, I think the holistic approach is something a lot of people
Yeah, that's what's
really
missing.
want. Yeah. Now you
Oh,
said 8 weeks. Like how many hours in a week would this be done? Is there kind of a standard treatment?
Yeah, 45 minutes a week. They meet with one of our clinicians virtually, a licensed clinician in your state. Currently, we only offer this in the United States and in India and on Canada too. We're offering it right now, and UAE if you're managing from other countries. If you're joining from other countries, we are a US company. Just to be on we are very, our offering is much more prevalent in the US than other countries. 45 minutes a week mark, and then they also have the device, so they have to practice maybe 20 minutes 2 days a week when they're not using it. The more you practice, the more the neuroplastic effect gets into effect. It works on the principles of neuroplasticity, right? You're just like how you're training your body, right? The more you
Right.
do this, we give them a protocol. We give them certain exercises to do at home without the clinician, but they're meeting with the clinician once a week for 6 to 8 weeks, 45 minutes commitment. Yeah, then they're done. They don't need this anymore.
Right. Well, that's only like 12 hours or something like that. That's really not a big investment of time. So that's interesting.
Yeah, yeah. And
Um,
it's good to do too. It's not tiring or anything like that. You're not going to the gym. You're actually doing it with the coach, so it's much more fun.
yeah. Okay. This is our third poll question, last poll question of the day. We're asking folks, what options does your organization provide for employees who suffer from chronic pain? And we're kind of giving you a list of things: health insurance benefits, EAP provider, health and wellness provider, ergonomic solutions, pain management, clinic solutions, other, and none of the above. So we're just trying to get a feel. We haven't collected data on this in our research yet. We're just kind of get a feel for what's out there. There's a lot of different ways that organizations might be able to provide some help in this area. Uh, Siva, is there anything that you're seeing in this area that is sort of underutilized aside from what we were just talking about?
So if you look at currently what employers are providing, Mark, definitely many of them have mental health support. That's after COVID, many of the employers are providing there's a separate digital health employer, mental
Mhm.
health solutions. Musculoskeletal also is common. We see that a lot of musculoskeletal offerings out there, not for chronic pain and headache though. We don't see that. That's one thing that's missing, that addresses this problem, this ticking time bomb that I'm talking about, not addressed, right? Because it doesn't show up in claims data. That's the major thing. It comes under neurology as a whole, but not underneath. So they're not digging deeper into the data. Yeah.
Right. So the data's in. Health insurance benefits is the most widely selected one at 90%. EAP provider at 77%. So those programs are also pretty widely used. And then we get into lesser used programs: health and wellness provider, 35%, ergonomic solutions, only 42%, pain management clinic solutions, only 8%, other 5%, and none 5%. So that's kind of the kind of thing I would expect. The health insurance and EAPs would come up top here. Do you have any insights into this, Siva?
So the health insurance absolutely is there, but the issue is access to this providers, Mark. So for something like this new treatment, um, health insurance, most of the times it's harder to get it covered, right, through the insurance plans. And they have to go through all kinds of things. So it's very difficult given the current fee for service model that these health insurance plans have. They want to deny the claims, and so the employees really struggle. Employees really struggle to get it through. Not that they cannot get. I mean, how many people could go to Mayo Clinic, right? From some part of the world. That's the access is the major issue I see. Not so much in the insurance. So that's what solutions that provide direct access to some good care like this is beneficial, right? That's why
Yeah,
many employers opt for our digital health solutions.
right. So we have a question, and I don't even know what it means, so I'm going to ask you, Siva. Um, she asks, is this like a TENS unit?
No, that's why I wanted to clarify upfront. It's not a tensionate you see in a physical therapy clinic. No, this is a mind-body foundational science is called electromyographical biofeedback. That's the foundational science for this, but it's a little more than that. It's not a tension unit, definitely not. Tension units are sending electricity into the body, and that's cheaper to get. This is a much more well-studied program at Harvard Medical School and Mayo. But it's also look at the other things that I talked about the whole person care about diet, exercise, and medication management and vitals as well. So it's not just we are just giving this device to you, right? You're getting access to these experts who have studied this in a comprehensive way, right? So definitely not a tense unit. Uh, it's a much more comprehensive product.
Okay, great.
So this is a
So
clinic. Yeah, go ahead, Mark. Yeah.
yeah, let's tell us a little bit about the clinical trial you're mentioning on this slide. This looks pretty complicated, so if you could walk us through it.
So we did this study at Harvard Medical School. If you don't know who Carolyn Bernstein is, Dr. Bernstein is one of the top migraine specialists in the country, in the world, not in the country. She has written the book on migraine, and she advocates this comprehensive care, right, for migraines. As I said, there are only 100 such doctors in this country who specialize in migraines. She did the study, and we did this whole program at Harvard, and we showed that patients who went through this program had a significantly less headache impact. They had a significantly less migraine frequency. We did not stop the drugs. We had them take the drugs. We just put this on top of it. But even with the drugs, they are only about 60% effective. When they were in the program, they had significantly less impact of migraines, less frequency. But the most interesting thing that came out of this, uh, patients who are going to start a family or pregnant, they cannot take those drugs that are currently prescribed, right? And these are called CGRP inhibitors. These drugs stay in the bloodstream for 6 months even after you discontinue, right? So those are the ones Dr. Bernstein said, hey, it's fantastic. This is helping patients have less migraine impacts and migraine frequencies. And the data is out there for many, many years. We knew this works. But the most interesting thing is the newer medications have side effects that I cannot give to my pregnant patients or patients who are about to start a family. And this is the only thing I could prescribe. So they're prescribing JOGO for those patients. So these are some studies done, published again. We can look it up online, which is this comprehensive whole person approach to treating migraine.
Excellent. Well, can you continue with this slide? Tell us what this one's about.
Yeah, so this is an interesting study we did for chronic lower back pain, right? So you see, low back pain is also a big cost for employers. Normally, you will have a musculoskeletal solution, digital MSK, they're called these days, but they don't address the chronic side of migraine, right? Sorry, the low back pain. The chronic lower back pain is also called non-specific low back pain, where physical therapy would be actually not good for you. You should not do physical therapy once you get chronic. It will actually hurt you more. And those are the patients we picked who have already done their physical therapy or had gone through the digital MSK or even regular musculoskeletal program. Then they have chronic pain, and here we go. We have this. We did this program and we showed this the outcomes of BPI, which is called a brief pain inventory, that they measure questions like: Are you able to function at work? Can you walk? Can you sit for half an hour? Can you function at work? Things like that. And it was better than oxycodone and tapentadol. So tapentadol, oxycodone are opioids, you know them. And it took 12 weeks for somebody who's on an opioid to get to that level. Uh, uh, and tapentadol, it took again 12. We were able to achieve it within 8 weeks with this all with our program. And of course, opioids have their own issues of addiction and things like that. So this is again another study done at Harvard Medical School.
Great. Cheryl asks, actually, what is JOGO? We should probably talk about that a little bit. What exactly is JOGO stand for?
Right. So JOGO stands for Joseph and Gordon. There are two physicians at NYU and Rockefeller who created this. It uses, if I can go back to the previous slide, Mark, if you don't
Sure.
mind, the two slides that are where the product was displayed. I can explain what it is.
Oh, before this one?
Yeah, I think there was a slide that showed the product screen. Yeah,
right there.
this JOGO, right? So JOGO is a program, also a device. So it uses this electromyography sensors, which measures your muscles electricity, and it reads muscle tension basically. And then it has an iPad. This is an Android tablet, which actually helps you bring awareness about your own muscles, right? Remember, we are trying to break that pain, anxiety, muscle tension cycle in your body to help with your chronic pain. And it brings immediate awareness about your muscles, thinking, hey, I have high muscle tension. I didn't even know. And which muscle I am having high muscle tension? Is it the frontalis muscle, the traps muscle? And it gives you immediate awareness about your muscle. Then there are protocols that we have developed with the help of Harvard Medical School and Mayo to help you bring those muscle tension down through a very simple mind-body technique, right? that you're given as an exercise program, and you're working with this machine to bring your muscle tension down with the help of a physical therapist or a clinician. And then after 6 to 8 weeks, you see immediate, not immediate, after 6 weeks, you see reduction in your muscle tension, which reduces your anxiety and then pain, and it works better than medications, right? So that's what basically the JOGO, the devices. The JOGO, the rest of the program in JOGO is looking at your entirety of your medications and your diet and exercise programs, so that we can also look at you from a comprehensive perspective, right? That is
Mm,
also part of this. Then you're also getting access to specialists. So if you have not seen a headache specialist, we'll connect you with a headache specialist who fully understands what's going on in you. And that's also we offer this part of it. So think of this as a comprehensive solution for your chronic pain and pelvic floor. We are not just addressing one piece of it, right? It's a very comprehensive program.
excellent. Yeah, well, thanks for clarifying. I think some people are just confused. You and I are using it like we know what it is, which we do.
Yeah.
But all right, so let's talk a little bit about this slide as well.
Yeah. So these are again, we talked about. I know this webinar is about chronic pain, but pelvic floor disorders, which also includes incontinence and pelvic pain, right? Chronic pelvic pain. So these are studies published at the American Urogynec Society and International Urogynec Society, where we have shown that patients who have tried this have 95% improvements in incontinence after 10 sessions. That's much superior to surgery. So if you go for a surgery, which is about $40,000, they'll put a medical device inside your body to control your bladder, and that costs about $40,000, and then you have to change your batteries once in a while, and you don't want to have that. And that actually has only about 80 to 90% improvement, and this has 95% improvement without any intervention. This is non-invasive, this treatment. And
Right.
voiding dysfunction, which is the opposite of incontinence, or patients who cannot empty their bladder fully, right? And that is also an issue. And this works for that as well, for voiding dysfunction. It works for pelvic pain. We treat a lot of veterans who come back from war having pelvic pain. We treat them. And originally, when Dr. Brodney, who created this at NYU, was treating World War II veterans who were suffering from stroke and others, that's how this started out. We just took his work and bringing it to life right now. It's all developed by Dr. Joseph Brodney and Dr. God Silverman at NYU. So is the device insurance covered by insurance? The reason we are talking about this to your employers is to cover this under your employer plans. JOGO as a service is covered by all insurance plans. The device itself is not covered. You have to pay out of pocket. So that's what the employers are covering right now. So if you go to your employers, hopefully they're self-insured, they can cover the entire program. So you don't have to go through insurance. You can just directly go to your employer and get it done. We have many such companies who offer this as your benefit to you. But other than that, JOGO currently is covered as by all insurance plans as a service. But if you want to take the device, which is important that we to keep it home, that you need to pay out of pocket.
Got you. Okay. April asked, would you mind repeating what you said earlier about physical therapy and lower back pain?
Oh, okay. So low back pain, when you have, let's say you hurt your back and you go to a doctor or ER, the first thing they will tell you to go to physical therapy, you should. That should be your first line of treatment. You have to go to physical therapy, and you get your physical therapy either through your digital MSK provider or directly, right? Then after 6 months, if you still have pain, then it is called chronic lower back pain. So chronic lower back pain means your brain has become centralized in your central nervous system. It's you actually done everything you can to fix your problem that you actually had, um, and now you need to tackle it differently. If you go back and do again physical therapy, it's actually going to hurt you more, right? Because you already done what you're supposed to do. That's when this comes in, when now you have developed this pain, anxiety, muscle tension cycle in your body. That's what's causing your low back pain, chronic low back pain. So we fix that first to break that pain, anxiety, muscle tension cycle, very specifically the muscle tension. Now you are out of your pain has come down. Now you don't have pain. Now you can go back and do your physical therapy, right? To strengthen your core, they say. So that's the phase this comes in. When physical therapy is finished, now you still have pain. You don't want to go on opioids. You should not have opioids. You should try something like this. Then after your pain has reduced, now you can go back and continue physical therapy. So
I
that's
gotcha.
essentially where this comes in.
Okay, sounds good. Well, why don't you tell us a little about your team at JOGO and the people you're working with?
So I want to talk about our advisory board more than what who runs the company. It's mostly folks from Yale, Columbia, Dr. Olivia Bigas. You saw that she's the one who wrote that paper about migraine. Dr. Edwards is a pain researcher at Harvard Medical School. Dr. Gary Kozlowski, he was an NYU professor, and also he's the chief scientific officer. A lot of his work has gone into this. And Dr. Lazarido at Harvard Medical School. So the reason I want to just put it out there, it's backed by some of the top researchers from top institutes about what we are trying to do here. So that's the message here.
Yeah, all right, great. Well, we have had a lot of questions and answers, but let's get to a couple more. And thank you for everybody who's been chatting. It's been a very well-used chat today, and we really appreciate you doing that. And April says, thanks for clarifying. All right, another question is what do you think the future of pain management actually looks like? That is, how do you think things are going to change over the next several years?
So I will go back to the first comment I made. If anybody wants to reach out, please, I will send the paper from Lancet. The Lancet is the #1 medical research journal in the world for many JAMA, of course, and also Lancet. So Lancet in 2021 wrote about pain management, and they said pain, chronic pain, very specifically, is a neural signaling problem. You cannot just suppress the pain by giving medications to suppress the pain. It's going to come back, right? You have to treat it as a neural signaling issue, which is basically when neural signaling means your brain and your muscles are sending signals to each other about your pain, and you need to tackle that. So that's basically what we are doing. And this is not the only solution that will solve this. You know, there is pain reprocessing therapy. There is something like we teach, and that's also something we do as part of a program. It's called pain neuroscience education, explaining the patient about why you are hurting, right? Why is it hurting when you're having chronic pain? And fear avoidance. You normally avoid things because you had pain. And coming off of that, it's actually scientifically explaining what's going on in your body. And that's plus physical therapy. It's very key part of it, physical therapy and movement and diet. And these are some of the things that are going to come into pain management, not so much pain medications. Pain medications are needed when you're in acute pain. None of these can fix your acute pain. You are in, just hurt yourself, you just fell off somewhere, you need meds to control, fix that. You need Tylenol. But that should not be a long-term solution. Your long-term solution is looking at why you are hurting and let's fix the root cause of it rather than try to suppress the pain. And that's where the pain management is going. I know the pain management is a very expensive field. People like to do surgeries and other things. There is a need for a surgery where you actually have some pathological mechanical problem in your body, then you need surgery. But surgery should be your last resort, and you should not be the first one. So there is a place for this comprehensive pain management, which we are talking about here, for managing the muscle tension in your body, and then breaking that pain, anxiety, muscle tension cycle, and doing pain neuroscience education, basically teaching yourself why you're hurting, and then trying to do changes in your lifestyle. And that's basically what should be done in physical therapy, right? That should be done for pain management. And migraine is a total different one, but
Yeah, I think a lot of people probably feel good about that in terms of taking a more holistic approach, not just putting everything down on a single bullet, whether it's a drug or what have
right.
you. So I think that probably connects with a lot of people. It connects with me anyway. Well, I think we're at the top of the hour. So thank you everybody for being here. We really appreciate you. Thank you for the great questions. Thank you for the great chats. If you have any questions, feel free to tell us, tell me. I think Hester is going to collect some things afterwards, and I will put you in touch with Siva if needed. So happy to do that. So thank you so much, Siva. This has been super educational. We really appreciate you being here.
Yeah, I'm tapping my email in case anybody want to get in touch with us directly. And you would touch with me. You can get in touch with me directly, or you could get in touch with Gavin. Um, I'm just typing our emails for you to get in touch with us. Yeah.
Into the chat. Yeah, that's a good idea.
All right.
Okay, so everybody, it's the emails are right there. I think you asked one from Gavin as well. So yeah, thanks again for being here. And with that, I think we're going to turn that back over to Hester.
I'd like to thank our presenters as well as all of you for joining us today. If you'd like to view this webcast again, the archive recording will be available on the hr.com website within 24 hours. The webcast credit will show on your hr.com account within 2 business days, and we'll also send you an email with your credit information. Your feedback is important to us. Please take a moment to fill out the exit survey that opened in a new browser page on your computer. This concludes our webcast. Enjoy the rest of your day.
Thank you.